I'd like to talk to you about some common knee problems that we see. Knee problems can really be defined in two different ways: acute knee injuries and then knee injuries that come on slowly over time. Right now I'm going to talk to you about the acute knee injuries. One of the acute knee injuries that we see is a patella dislocation. So the patella is the kneecap, and oftentimes, particularly in our youth, we have instances where around sports or around dance and sometimes other activities, when you pivot, your kneecap can come out of place altogether. It's very painful, usually comes back into place on its own, and will leave you with a big swollen knee. If that happens, that's the type of issue where you should contact an orthopedic surgeon. Typically you'll have an MRI and the diagnosis will be made. If it's the first time that it's happened to you and there's nothing else but just the kneecap dislocation, it can usually be managed with therapy and a gradual recovery. If it happens multiple times, oftentimes a surgery is warranted to help fix the problem and stabilize the kneecap. Another type of acute knee injury is an ACL rupture. So most of us have heard about ACL injuries from watching basketball or football, and we may even have friends or family members that have had an ACL tear. But just to give you a summary, the ACL is one of the main ligaments in the knee, and it provides the rotational stability. So if you're just running in a straight line, you actually don't need your ACL. But when you go to cut and pivot, if your ACL is not functioning, your knee will be rotationally unstable and pivot out of place. Oftentimes when playing sports, we have what's called a non-contact pivoting injury, meaning that you're playing soccer and you go to pivot and all of a sudden you feel the knee give out and then you have swelling. Oftentimes that's an ACL tear. So anytime you have an injury that is acute from a pivoting or a fall and you have swelling, significant swelling in the knee, that is something that needs to be seen sooner rather than later, and you should contact your orthopedic surgeon. Another type of acute knee injury that we commonly see are meniscus tears. The menisci, that's what we call meniscus in the plural form, menisci. The menisci are the two shock absorbers that live inside the knee between the thigh bone and the shin bone. When you have an injury, either a twisting injury or oftentimes a squatting injury or from doing jump squats, you can load that meniscus and tear it, and you'll get a lot of pain at the sides of the knee, oftentimes accompanied with some swelling. Once in a while, the meniscus can even flip out of place, and then it blocks your knee and it can't come straight. So if you have any significant pain on the sides of your knee, or a knee that's blocked and can't come straight, or significant swelling, those are the types of things that should get checked out sooner rather than later. Also very common are what we term chronic knee injuries or overuse injuries of the knee. So for example, a runner who is increasing the amount of their mileage every week might start to get pain in their patella tendon, the tendon that connects the kneecap to the tibia. Or if you do a lot of stairs, or a lot of squats, you may get pain in the front of your knee from the increased contact and stress between the kneecap and the groove that it sits in. These are very, very common, and there are some clues that you can use to help determine whether you have something that you can give some time to get better or whether you need to see an orthopedic surgeon. In general, if you have an increase in activity and now you have some pain or some soreness, and the pain is manageable, so it's only a 2 or 3 out of 10, you can give that some time. And the other warning signs to look out for are swelling or any what we call mechanical symptoms. So if there's no swelling, there's no significant clicking, catching, or anything else unusual, that's the type of injury that you can give some time to get better. You can do your normal icing, anti-inflammatories, and avoiding activities that seem to bother it, and then see how it goes. If you're still having significant symptoms after a few weeks, at that point you can contact an orthopedic surgeon to help make sure that there's nothing more going on.